So this week's research spotlight is Synergies in Health and Disease, Relations to Adaptive Changes in Motor Coordination. And this article was sent to me by Dr. Joe Ricotta. He graduated from Ithaca in 2017 and completed the orthopedic residency at Cayuga Medical Center and is currently pursuing his PhD in motor control at Penn State. And it's kind of a funny story. Last week there was a lot of discussion just in my mentor sessions and kind of throughout the week at the clinic with my patients about motor control and just kind of this topic of motor control. And then coincidentally last week I had reached out to Joe and just kind of asked him if he'd be willing to come on for the podcast I'm kind of getting started up, and he invited me to the Penn State Action Club for their motor control research, and then for researchers kind of all over the country that present, and then it's like a debate, and basically they try and challenge the research that is being presented, just so then it kind of helps everyone build a little bit better understanding and challenge some things and ask questions. And this article is by Mark Latash. He is Joe's advisor, and he was also at the Action Club, so that was pretty cool. And then afterwards, Joe and I talked a little bit, and he had sent me this article, so I thought it'd be a good one to read, just because as I get more into this residency, I have more questions than answers sometimes, it seems like, about motor control. But I really like this article because it kind of explains that we don't really know what's going on, but we're figuring it out. So this article was published in Physical Therapy in 2006, and it talks about how there isn't really a well-defined idea of motor control. It's kind of all of these different systems and ideas and thoughts, and they propose this hypothesis of what they call an uncontrolled manifold, which, if I'm interpreting the article correctly, is essentially that our body works in synergies to accomplish tasks. And the task of touching my glass there is a task, and there's multiple schools of thought on how my body coordinates and gets that entire movement to happen. But with the uncontrolled manifold hypothesis, essentially it's that my body knows that I have to perform this task, and there are infinitely number of ways I can move my shoulder, elbow, wrist, pronate, supinate, move my fingers in order to accomplish that task. And with the uncontrolled manifold hypothesis, as long as I accomplish that task, there's a series of synergies that are considered good within their variability that allow for efficient task accomplishment. And then there's a series of synergies that are maybe considered bad for accomplishing that task. And in order to achieve task accomplishment, there's a task, and then there's a defined success for that task. And as long as the end result of my distal segment is accomplishing that task, the variability more proximally is kind of fully dependent on the body, and as long as it can still accomplish that task within any variability of meeting that, it's considered good, and if it's not, then it would be considered bad. And what the article kind of goes into is how, when we're thinking of movement synergies, it's not necessarily in like the Brunstrom stages of synergy that we can see in patients post-stroke or traumatic brain injury or something, but more so that there's these synergies of movement that are meant for task accomplishment, and as long as all of the pieces of that movement are within enough of a variability range to accomplish the task, then that's an acceptable synergy. And if there are movements that are not within that variability for task accomplishment, it's considered a bad synergy. And when you look at testing, you can kind of figure out, okay, the ratio of good to bad synergy is equal to X, and then through training, does the variability of good compared to variability of bad change? Does it get a higher ratio? Is it a lower ratio, or does it stay the same? And they measure that variability of movement based on muscle action, and that is directed at task accomplishment, and muscle action that is not directed at task accomplishment. And essentially kind of what it boils down to is that with training of quote-unquote motor control and movement strategies and movement synergies, we're trying to improve the amount of movement within that good variability range for task accomplishment and minimize the variability outside of the quote-unquote good for that task accomplishment. That is kind of a confusing concept. I'm still not sure I have a full grasp and understanding of it. And you might read this article and have a totally different interpretation of it, but kind of my reading of it was my interpretation of it. I'll put my takeaways in the description below, just because writing them out might make a little bit more sense, and kind of using some of the excerpts from the article to explain it. But so yeah, motor control. It's the more I think I'm learning about it, the more questions I have, and the more, not confused, but the more, I guess just the more questions I have, and the more I feel like I don't have a good answer for any one aspect of it. But I highly encourage you, if you work at all with patients, to consider reading this article, because it can apply not only to patients with neurologic deficits, but it can also apply to patients with ortho deficits, and that may be appearing to be from a movement deficit or a movement incompetence. And so I think it's a great article. Again, it's from 2006 with Mark Latash, and he had a co-author on it. I'll put the link in the description to find it, and hopefully you get a chance to read it and can take something away from it. Thanks for watching.